This video is to introduce the lower quadrant rhythmic stabilization routine. Again, it's the progression from the initial aid. If you watch that video where you did exercise individually, contracting one muscle group, relaxing the same muscle group, but in reality the body works in synergies or in groups of muscles working at the same time, and there has to be coordination between muscles on opposite sides of the joint, on all sides of the joint, in order for there to be purposeful function. The talk for the rhythmic stabilization for the upper quadrant talks about the clearing up your proprioception and the need to have this coordination, so if you're interested in that, please view that video also. But with the lower quadrant rhythmic stabilization, you're going to take your bolster and you're going to put it long ways between your thighs. And then you're going to take your belt and you're going to put the belt around the thighs. This is the only hassle, but it's worthwhile. And the belt needs to be snug enough that when she pushes out against the bolster can't fall. And then she'll put the ball on her belly. So again, if you watch the initial aid exercise, you'll see that we are combining three of the exercises together. The exercise will be done in this fashion. She's going to compress the ball against her thighs. If she does, one time she's going to push out against the belt and squeeze her buttocks. She's going to take inventory. She's going to feel if the muscles are working symmetrically on both sides and if they're working well. She's going to feel the relaxation. Next time she pushes on the ball, she's going to squeeze the bolster between her knees and squeeze her buttocks. She's going to take inventory. Feel if there's a symmetrical muscle work on both sides. If there's any muscles that are inhibited, she's going to focus on waking them up. She's going to work on her body sense in her control. She feels the relaxation. As she compresses the ball against her thighs, she's going to push out against the belt, squeeze her buttocks. As you do this, you'll feel that there are different muscles, obviously, in your thighs, in your hips that work, but when you pay attention, there'll be different muscles on your pelvic floor and in your trunk. They kick in depending on if you're pushing in or pushing out. There again, there's this whole synergy that has to work in concert with one another in order for you to have purposeful function and to really protect your joints well. Again, as we talked about in the upper quadrant video, there's very good evidence that shows that when you have musculoskeletal pain, this coordination gets thrown off in 100% of us. And if you treat the pain, you treat the soft tissue, you treat the inflammation, but you don't re-coordinate the muscles, you have not completed your rehab, and you're going to leave yourself open for a recurrence or a re-injury. You're going to make yourself more vulnerable than if you finish the job. As she goes, she wants to have it so that there's a contraction that is built and she can control the vigor. Remember, it is in this stage, it is not about just strength and endurance, but it's about body sense and control, her ability to pay attention and feel the coordination of the contraction, feel the coordination of the relaxation. When she gets to the bottom of the relaxation, she wants to initiate the opposite direction. So there's not a real rest in between, because you want the coordination of one muscle group working, another muscle group relaxing, one muscle group working, one muscle group relaxing, so that you are building stability, rhythmic stabilization. You're building stability, in this case, in her shoulder girdles, in her trunk, in her hip girdles, in her thighs. As she progresses, then she'll try to get the whole synergy involved. So as she compresses the ball and pushes out against the belt, she will step on the gas with the ball of her foot, curl her toes, try to put an arch in her feet. She will feel the relaxation. When she compresses the ball and squeezes the bolster between her thighs, she's going to pick the ball of her foot up off the table higher, the ball of the foot up off the table, keep coming, thank you, and lead with the little toe side so that she's getting dorsiflexion, eversion, and that will help her stimulate. She'll feel a stronger contraction of the hip internal rotators and adductors when she does, because it feeds into the pattern. When she relaxes, she relaxes. When she compresses the ball and pushes out against the belt, she's going to step on the gas, put an arch in her feet, really get the toe muscles involved. When she relaxes, she relaxes. When she pushes on the ball, compresses the bolster between her knees, she's going to get that ball, the foot up off the table, get her toes as close as she can to her shin, leading with the little toe, so she's getting that dorsiflexion eversion as much as she can to really gear that. And by doing this, she's going to build an unbelievable stability in her lower quadrants. It is very common that when people have irritation in their low back, they do this exercise, their low back pain drops in intensity because the joints are being supported, you're pumping fluid in the area. It is a magic exercise when it comes to so many of your tissues and systems.